Orthostatic hypotension. Orthostatic hypotension is defined as sudden drop of blood pressure when the patient is made to stand from a supine position. So what is the classic definition says is that whenever the patient is made to stand from supine position, within 3 minutes, if the BP drops from 20, BP drops, systolic BP if it drops from 20 millimeters of mercury, or diastolic blood pressure if it drops by 10 millimeters of mercury within 3 minutes of standing, with or without symptoms of cerebral hypoperfusion, is called as orthostatic hypotension. So there is a term called as initial orthostatic hypotension and delayed orthostatic hypotension. Initial orthostatic hypotension, it is defined as a transient BP decrease within 15 seconds after standing. So from a supine, if the patient is made to stand, within 15 seconds, there is a transient fall in BP of more than 40 millimeters of systolic BP and more than 20 millimeters of 20 millimeters mercury of diastolic blood pressure with symptoms of cerebral hypoperfusion. Classical orthostatic hypotension is within 3 minutes of standing, and delayed orthostatic hypotension is after 3 minutes. How does heart rate varies in orthostatic hypotension? Rise in heart rate of heart rate of fewer than 15 beats. That is in response to blood pressure. If rise in heart rate occurs only by less than 15 beats per minute, then the cause is considered to be a neurogenic cause. However, if the heart rate increases by more than 15 beats per minute, then it is considered as a non-neurogenic cause. However, heart rate is not a specific indicator of underlying cause and could be inaccurate if the patient is on beta blocker. Suppose the patient is on beta blocker, this can be inaccurate. So another important thing to be considered is that orthostatic vital signs are best obtained after at least 5 minutes in the supine position or at a 60-degree angle on the tilt table, followed by immediate assumption of the standing position. So the difficulties of following this protocol in a busy clinical practice are recognized. So it is acceptable to compare values in the seated position, those after standing for 1 minute. So during clinical practice, you may various time found that it may not be possible to make the patient lie down supine position and then check BP after 3 minutes. In the busy clinical practice, if it is not possible to make the patient lie in supine position, you may check BP in sitting position, and then you should make patient from sitting to standing position for 1 minute, and then you check fall in BP. If the BP falls by systolic BP falls by more than 15 or diastolic falls by more than 7 mmHg, then also it is considered as a orthostatic hypotension.